not here and here. If you put them on both PSISs, you're not looking for the right thing. Because remember, you're looking for relative motion of the innominate on the sacrum. All right? So, thumb here, thumb here. What you're going to do is ask that person to bring their hip up to 90 degrees of flexion. Theoretically, what should happen as they go into flexion, that PSIS should drop inferior relative to S2. That is negative. That is a normal response. The positive test is if the PSIS does not drop at all or actually elevates compared to S2. All right? That's the positive test. And obviously, you're then going to compare that to the other side. Okay? Does that make sense? I find PSIS. I find S2, which is directly across there. I'm not going to sit here and count down to S2. Okay? So if I do, and then I say, you have to back up. Yeah. You guys see from over there? Is this okay? Or do I need to move first? All right. Bring your left knee up towards your chest to about 90 degrees. And you see how my thumb dropped down on her? You guys see that up there? I do it again. And down. That is a negative test. Now, I have my fingers resting on the iliac crest, just because I'm kind of trying to feel the whole innominate. Right. Go ahead, do it again. And down. That is a negative test. The PSI has dropped well compared to the thumb. I'm not moving. All I'm doing is getting my hands in position and letting my hands move with her hip. Now, do I need to, if I just touch skin, am I going to feel that PSIS move? I need to palpate the bone. I need to have some pressure on the bone so I can actually feel what it's doing. All right? Then I come over to the other side and I do it again. And I do it again, and I see that drop down nicely. Okay? If it was pathological, you're going to, I'll try to do it pathological. It's hard. You might see him hike the hip up like that. Okay? You might see him kind of hike the hip up. All right? Now, here's the thing. You statically palpate it. Right? You look at the iliac crest, the ASIS, the PSIS. You may see something that you believe is a dysfunction, either anterior or posterior rotation or upset. That alone does not, in any way, shape, or form, diagnose the SIJ as a problem, nor does it tell you what side the problem is on. Are they anteriorly rotated on the left or posteriorly rotated on the right? Pain does not do that. Just because it has, most of the time the problem is on the painful side, I will tell you that. But there are a number of times where the uninvolved side, the non-painful side, is the part that's not moving, and that's causing the involved side to move too much. Okay? So, you palpate the landmarks. You figure out the position that you think may be in. The Gillet's test, or Gillet test, all it does is confirm the side that the problem is on. All it does is confirm the side of the dysfunction that may exist within the SIJ. So once I know the Gillet's test result, I'm then going to call that dysfunction based on my palpatory findings on that side. So if my right ASIS is low and my right PSIS is elevated compared to the other side, I don't know if that's an anterior rotation on the right or a posterior rotation on the left. Once I do Gillet's, don't worry about anything other than the PSIS dropping down. If the PSIS does not drop down on that right side, you will say I have a right anterior innominate dysfunction. If it happens on the left side, you have a left posterior innominate dysfunction. Does that make sense? All the Gillet's does is tell you the side. Okay? You palpate to figure out what may exist. You do Gillet's to tell you the side. Yes?
Would you ever do, like, if you do flexion to see what happens? Would you ever have them do extension to see?
No. Never. always flexion. It doesn't matter what the dysfunction is. If the SI is stuck anterior or posterior or hypomobile in general, just not moving, the relative motion between the sacrum and the innominate is not going to occur. Don't try to think about it in terms of, well, what if it was stuck posterior? Wouldn't it be a little inferior to start? It doesn't matter because you're not going to be able to tell that anyway because we're talking about 1 to 4 degrees of translation, right? All you're looking for is motion relative. Don't break it down more than that. You're going to make it harder on yourself.